That's how we start.
All right.
Pretty awesome. Pretty awesome.
Alrighty, bonjour et bienvenue tout le monde on behalf of the Fourth Space team and the new initiative to Black Community Health Check. We are streaming on YouTube live from Concordia University's Fourth Space, which is located on unceded Indigenous lands in Tiohtià:ke, Montreal. At Fourth Space, we collaborate with our university community to bring people together around the research projects, initiatives, and dialogues, conversations that are in development across the uni. And this week, we are very honored to have the opportunity to collaborate with Annick Maugile Flavien to host this week's series of events focused on Black community health in the home, the community, and healthcare facilities. Before passing it over to Annick to introduce her guest today, I'll just remind you that we do welcome comments and questions in the chat or with raised hand if you're joining us by Zoom. All right, welcome. Over to you, Annick.
Thank you so much. I am so excited to have you here today. So this whole week is a conversation around Black community health. Part of the reason that I wanted to bring this to the forefront is because of my personal research, where I'm looking at caregiving in the Black community and trying to understand the role that caregiving has in facilitating access for a lot of our community members who would otherwise be really kind of removed from healthcare. And so it is such a pleasure to have you here because you've worked in so many different contexts and have many different perspectives on this. Just to present you, Kimani Daniel is an associate professor in the Ingram School of Nursing at McGill University. She has over 15 years of experience in perinatal health. In her role as a clinical nurse specialist in maternal child health at the Centre intégré universitaire de santé et des services sociaux du Centre-Ouest de l'île de Montréal. She has been involved in educational initiatives, quality improvement projects, and policy development. She was the site leader for the quality improvement program MORO-B, a comprehensive performance improvement program that creates a culture of patient safety in obstetrical units. She is currently the Quebec director for the Canadian Association of Perinatal and Women Health Nurses, that's right, and has a passion for meaningful exchanges in social justice issues affecting the African diaspora and creating opportunities for change through learning. That is quite a bio.
Thank you. I'd love to meet said person. It's fantastic.
Yeah, that's wonderful.
Fantastic to hear. Thank you so much for having me.
Yes, for sure. I really just wanted to start our conversation by, when you hear the word Black community health, like the term, like what does that mean for you? How is that different than, say, public health, especially as a health professional who actually, knows the true meanings of these words? Can you tell us a little bit about that?
Yeah, so I think, when we think about public health, and many of us, of course, our knowledge around that lingo is really quite present for us just in terms of being still in the ongoing pandemic. And so public health really focuses on, what are those systems sort of structures, what are those systemic structures that we can put in place in terms of, sort of marking some of the trends around infectious diseases, and looking at public health as a whole. So the whole population is rather large in terms of focus, versus community health would be something like that is a lot more specific and really targeted to a specific community. So in this case, when we're talking about Black community health, we're really looking at what are the strategies that we can put in place to help the Black community maintain their health. And so what is already in place, because I really do believe in that self-determination and that nature in the Black community to determine their own health, and there are all sorts of practices that the Black communities have been engaging in for a very long time that help them maintain their health. And then how can we, again, bonify some of those things and then add to them in terms of providing access for strategies for the Black communities to maintain their health. And so some of this, again, would be, again, just to use the COVID-19 pandemic as an example, would be to target strategies specific to that community. And so, very recently, we've heard some data coming out from StatsCan, sorry about that, that indicated that Black community was particularly targeted by the COVID-19 pandemic. And of course, it's of no surprise to many of us who work in healthcare, knowing that we are often the providers of healthcare services, but sometimes do not have access to those same healthcare services. So it's a bit of a cruel joke that we are kind of like integrating into the healthcare system in that way. And so some of that data really supported that the Black community needed to be sort of targeted for efforts to I guess, maintain their health around COVID-19 because they were more likely to be targeted by the virus and have, of course, some of those sort of the social ills that come with that, have long COVID, have limited access to financial means to maintain their health when they're out of work, things like that. So for the first time, and what I think is really part of the key of this, for the first time we had data to support some of the hunches that we had had for so long. And I think that sometimes in Canada, what we're missing is that Canada-specific data when it comes to Black communities.
For sure.
So that's really important when I'm looking at Black community health. I don't think that you can have a really good conversation about Black community health without talking about trust and betrayal, of course, and that historical sort of mistrust that's really embedded in that system. And so if we're trying to look at how can we talk to or talk with and co-create with Black communities around health, we need to pay attention to that because it really is driving a lot of the behaviors that we're seeing, and it's driving some of the discussions and conversations, and necessarily so. It needs to be named, and we need to sort of unpack some of the language around that because we won't make progress on either side.
Yeah, for sure. When I was thinking about naming this week of conversations, I didn't just want to call it Black community health. I really wanted to think of it as almost like a pulse check of like, are we doing okay? And so in your in your opinion at this moment, you know, like, because we know that the history of healthcare is a very, very long history. And I try to not stay in a framework where it's like everything's bad or everything's good, you know, like really trying to keep an objective perspective as possible. Do you feel like the last, you know, 2 to 3 years, kind of a racial awakening, everything that we've seen, you know, you talked about this in terms of the data that's come out of this. Are we doing well in terms of a community, and are needs kind of more at the forefront than they have been? Are there concerns that you have that might have come up from the last few years of kind of institutional change, let's say?
So the short answer is we're doing better, but we could be doing a whole lot better, and there really needs to be a whole lot better. And so when we talk about that sort of watershed moment in terms of, you know, the pandemic and then, of course, the coexisting pandemic right after the George Floyd massacre, what was really interesting was that we saw all of this hubbub and we saw all of these sort of like percolating events, and everyone wanted an equity, diversity, and inclusion team, and we wanted to talk about anti-racism all of a sudden. And so some strides have been made. It's not to negate that some strides haven't been made. Certainly there are more faces at the table. I mean, in spaces where, and conversations that I'm having, I think in, particularly in academia, because that's where I'm working from right now, faces in terms of, like, there are more Black faces at the table. And there have been efforts in order to increase representation, to make things more accessible, and that's, you know, programs, educational programs, frameworks, healthcare access in some way. And there's certainly an increased consciousness, I would say, around the issues. That doesn't mean there isn't still anti-racism. That doesn't mean that every single person has jumped on the bandwagon, and it doesn't mean that all the structures are in place so that we can have sustainable change, right? So some of those things are knee-jerk reactions that say, okay, we'll give money to this particular cause for maybe 6 months to a year kind of thing, right? And the EDI teams
that'll
formed.
fix everything.
That's it, exactly. I have an EDI team. They're working on something. I just don't know.
This is not generations of systemic issues.
Well, this
that
is what
we're-
I'm saying. Exactly. So right now, I think what the key thing for us to do right now is really to look at how can we maintain some of those changes.
For sure.
And I think that many of us in the space of, again, being at the table where things are being discussed, really are seeking that. And from the beginning, we were seeking that in terms of how do we track that things are actually being done, that change is actually being made? How do we hold people accountable for that meaningful change over time? Because we've seen this before.
Yeah,
It's
for
not
sure.
something that hasn't been done before. Certainly there's a renewed awakening and it's better than it has been in many ways. But we've seen the cycle repeat, and we want to make sure that some of this change is sustainable, and so that we can evolve in the coming years, I think.
Yeah,
Yeah.
for sure.
So it's changed things, to answer the questions. It has changed things, but there's lots more to go, for
Yeah.
sure.
No, definitely. You talked a little bit about the fact that you're teaching right these days. Can you tell us a little bit more about your path with healthcare and the different ways you've kind of encountered Black community health in those different spaces?
So, so you mentioned, in great bio, that I came to healthcare knowing that I wanted to work in maternal child health. And I started as a staff nurse in the obstetrical unit, and I continue to work in that space. I continue to work in that space as an educator, and then of course as a clinical nurse specialist, and then now as an educator in terms of at the university. And so the ways in which I saw some of those interactions happening, and again, there is again a renewed consciousness around those Black maternal health outcomes that have been, kind of like all the rage right now. People are really, really aware of the differences in terms of outcomes, and sort of the stories that have come through the media around, Black women having difficulty accessing care or having their voice heard. And so have I seen that? Yes, I have seen that in many ways. Did I articulate it very early in my practice? No. Could I have articulated that that's what was happening? No. So again, we're all on this journey in terms of articulating it for ourselves in terms of our life story. And I think I come from, I chose nursing myself because it really fit with my values in terms of seeing the person at the center, and then looking at health along a spectrum, and then considering that global view of health. And so it isn't just, this person, lying in a bed wanting to have a baby kind of thing. It's, what is the context of taking that baby home? What are the community supports that are available? How did she come to be here? And then, what is the context of the relationships that she has that allow for success, right? And so, and that extends to systemic sort of either barriers or access points that may or may not be available in her life. And that, for me, it's really kind of embedded within, nursing that particular patient, that we considered a really sort of global view of health. And so that is not always so. And part of the change that I think that some of us want to see in the healthcare system is really having that view. And so wouldn't it be great, a bit idealistic, but wouldn't it be great if that person really was viewed in terms of that, entire sphere of her particular health, and then all of the systems were kind of running up to meet her to support that. And that there was representation at the bedside, and that there was representation in the boardroom, and that there was representation in management, so that all of the policies that affect her are really coming from a place of intersectionality and representation and inclusiveness.
Yeah, for sure.
So I think that really drove some of my thinking around that, and then the opportunity to be involved in some of the initiatives that I've been involved in thus far came, I think, in the last couple of years. So that was helpful for me to sort of make sense of what I was seeing at the bedside, and then also making sense of that more recently as well.
Yeah, for sure. I feel like, one of the things that you talked about in terms of clinical practice and then in terms of working as an educator, right? And how it's almost like your practice allowed you to now be better equipped as an educator and a more rounded, not only experience, but really just like an understanding of what that is. And even if we're not necessarily able to verbalize it in the moment that we're in the practice, that still impacts the way in which we kind of impact the education to come. And I was wondering about, how you were speaking about, Black maternal health, like you said, is very prevalent. It's like seen a lot in terms of Instagram posts, in terms of like the social media aspect of this. Do you find that this impacts students from non-Black communities in the way that they, like the questions that they may be asking, and the way that they kind of approach their own healthcare education? Because I think that that's one of the goals of social media, is that it creates kind of a public awareness that will then impact professionals from many different fields, whether or not that's in their educational kind of curriculum, right?
I think students in general are, first of all, students are awesome. And then they force us to reckon with what is today and what is present day awareness, right? And so that student sort of advocacy for us to deal with these issues and for us to make things more accessible is fantastic, because it really pushes the institution to respond to these issues in a way that even faculty can't push, or the community can't push, right? And so what's nice is that what I love about this generation is that they aren't afraid to have those conversations, and they aren't afraid to ask for what they're seeing and reflect that back in conversations. So some of the conversations, again, that I'm able to engage students in are things that they are seeing in clinical, and then how come this isn't so? How come our curriculum isn't paying attention to differences in skin color? How come our curriculum isn't making all of us feel included in XYZ situation, kind of thing? How come this case that we're talking about, this case scenario, is told from this lens and with an ableist ideology, and isn't really paying attention to heteronormative standards, kind of thing? So I am always really heartened when I hear that feedback from students, because I think it forces us to take a step back and really look at all of our privileges, right? And so it isn't just white privilege, like it really is, all the privileges that we all come and sit down at the table with. So I'm happy to hear that. One thing that I will say is I actually, and this is not my story, this is a story from Instagram, actually. And I loved it so much because it really drove home the point for me around representation when, students were saying, what's the big idea around representation in maternal child health? And so it was a story of a nurse who came onto her shift. Again, she was the only Black nurse in a labor and delivery department. And she came onto her shift, and she was receiving a report from the outgoing nurse, and the outgoing nurse said, oh yeah, there's a patient, and you know what, I wrote up a psych consult for this patient, and there seems to be something going on. And so she said, well, that's kind of weird. Like, why did you write up this psych consult? And for those of us in healthcare, when you write a psych consult, it's essentially to say, I want the psychiatrist or the psych team to come and see this patient because there's something going on. She needs assessment. And so the Black nurse inquired, and then the other nurse said, she just keeps hitting her head all the time, and I think she needs to be seen, right? So the Black nurse kind of peeked in the room, looked at the woman, and then came back and said, oh yeah, that's just something we do. And she's like, what do you mean? She's like, oh, well, she has a weave, and when it gets itchy under the weave, and the thing is, I'm looking around, and you guys can't see, but there are Black people in here nodding.
Oh,
yeah.
100%.
Because we all know.
Oh, this. And the pencil. You might have a pencil. You might have all kinds of ways that you deal with that. And
I can't itch because I'm about to do a perm, right?
For sure.
That too. So I love this story. Why?
my
Because
gosh.
it really, it tells us like we need to be there because one, think of the healthcare costs
That's crazy.
to a system that made a psych consult for a very explainable thing in the Black community.
Yeah.
And this is why it drove home the point to me in terms of it being everyone's problem, because the healthcare costs are everyone's problem. And then two, who did that the psych team not see
Because
that
they
actually needed
Yeah.
the care at the bedside? So I was like, you try to explain the representation. You're like, why is it important? Can't I? It's still important. Like I need to have, the Black nurse, the Black PB, the XYZ person caring for me, and we need to be represented because the population we serve is who we're here for. And so that's what I try to drive home in terms of looking at our curriculum. We're responsible for the population we serve. And so if our curriculum is not inclusive and representative, if the teacher is teaching it or not, if the students aren't, then what are we really doing? Are we really serving the needs of the population, right, as healthcare providers?
Sure.
So I don't know. For me, it was like a little aha
that's a
moment.
great-
Like
thank
love
you.
it because people learn through storytelling. I mean, I believe that too.
No, but I think that
Yeah.
that's so key. We forget like what that actually looks like on the grounds. Like there's this idea of like, oh, it'll only happen when there's an emergency in this thing. Especially when we talk about Black maternal health. Like I think that people like automatically think it's like when she has a C-section, when it's like, but
Yes.
no, it's like the very mundane, she's scratching her head stuff too,
Absolutely.
Like,
And super mundane, right? But if you think of like those who know what can happen
No, for sure.
with a mom who has psych consult, and maybe it would have been explained away, and maybe someone else from another community would have understood,
But it could also not.
but it could also not.
Well,
And we know, what kinds of relationships we have with the foster care system, and we know what
100%.
relationships we have, so et cetera, et cetera. So
I mean, I had an experience when, so my son was born with the Mongolian spots on his back, which look like, it's a hyperpigmentation, and so they look kind of like bruises, right?
yeah, my son still has his.
My
He's
son-
like 3. He still has it on his butt.
He
Yeah.
still has his stuff. And I had a Jamaican nurse, and she came to me and she said, I'm gonna write it on his file that he has it because I don't want you to have problems down the line. And that shook me so hard, because it's only someone from my community who would see what could happen down the line, who would care for me enough to want to prevent that for us, right? And just understand that there's a whole social cultural history,
Yeah.
right? That
Yeah.
makes it that we can't just be confident that like, oh, these things that are very medically explained on my child's body
Yeah.
will not end up being an issue for us down the line.
Yeah.
That's
Absolutely.
That's really
And so, we have a generation of people or like healthcare providers like that nurse who intervene in order to safeguard Black health, right? And so what I love about, again, this generation is that they're like, no, let's talk about it.
Yeah.
Let's talk about it so our allies know that.
100%.
So that like all the communities know that and know what we're doing, right? And give voice to all of this work that has been like all this safeguarding, all of the sort of burden that's been on the shoulders of, Black nurses, for example,
Yeah.
for so long, to sort of, to maintain that health.
For sure. I really love how you're talking about it because I think that one of the things that happens is there's this sense that when we talk about Black community health, only Black people can speak about it, or it only impacts Black people, or that it is something that only health professionals should be, like this is their concern. I'm not part of that conversation, but it's like, no, actually, like these things that people put on social media, that the community activism, the caregiving that you do, all of that really is part of the ecosystem, right? It's so key. I want to chat a little bit about the initiatives that you're taking on, and the initiatives that you kind of see around you. There's so much that's happened in the last few years, and probably many years like before. Like you said, a lot of this is in waves and cycles. They come back, and like all of a sudden people are reinvested in this type of work. But what does it look like in terms of the field that you're in?
So you kind of hit on some parts of that when you were talking about like having, seeing health as not just what's happening in hospitals, but essentially everyone being part of it. And so I think some of the focus right now is around if we have this broad definition of health, and people exist within this microcosm of healthcare relationships that are not just the hospital, not just CLSCs, but outside of that, what is the role of community in terms of building the healthcare system? Not just responding to the needs of a fractured healthcare system, but how can we actually engage the community through partnerships in terms of building the system. And so some of the work that I'm really excited about doing right now is engaging that community in building how we should serve them. And so what I was talking about before in terms of, you know, how do we prepare nurses for nursing in this essentially times, or in the current time, and for inclusive care, is part of a project that I'm working on in our particular department at the Ingram School of Nursing. So we're interested in, certainly part of this is in creation of our social accountability office. But part of that is how can we onboard community and have them engaged from the get-go in terms of curriculum. So all of the responses that we have from students that are saying, you know, the curriculum is not responsive to our needs in these particular ways, how do we engage community and have them build the curriculum with us? I mean, I would say, you know, decolonize the curriculum essentially 100%. With us, right? And so what I'm probably going to be working on in the next year is starting some of that community engagement to have some of those conversations to set the stage for integration of, you know, that consultation into our curriculum. And so I think that's a really important piece of it. Another important piece is, again, representation. I keep going back to it, but representation in terms of healthcare, but, you know, again, medical school, right? And so there are new pathways being built in terms of, you know, the Black applicant pathway in medical school and those sorts of things. So some of my time is spent advocating for and participating in meetings in terms of really allowing access for representation starting from medical school, and so that there are more Black faces in terms of physicians, right? Yeah, sure. And so again, it's a bit of a pipeline sort of project to at some point allow for our healthcare system to be more inclusive and respond to things. And I think that when we think about our healthcare system right now, and I'm very cognizant, I'm speaking like on the eve of our provincial election. And when I think about our healthcare system right now, there's definitely room to grow, and there's definitely room to name some of the things that we've been seeing, like, and it's fractured and it needs help.
100%. When we talk about community health, Black community health right now, I think that the two kind of themes that have been most public have been Black mental health and Black maternal health, right? Those are two kind of themes that are really like a call to action. And I always, as someone who, you know, I guess because I'm a minority, I'm always a little bit concerned when certain things get really public, because I know it erases other things, right? And so without kind of trying to take away from the urgency and the importance of both of these kind of health concerns, are there other concerns that you think are impacting the Black community that maybe are not getting as much light as they should be, or are maybe even connected to these health concerns that we should be also thinking through?
Yeah, really good question, because it's making me think of particular, I guess, causes, diseases, comorbidities that don't get the limelight and wondering why they don't, kind of thing. And so you can imagine, I mean, diabetes and heart disease still killing people. And like it stays killing people, you know? And if we looked at the deaths that are related to that, I mean, we could imagine that, you know, the deaths are, you know, 10 or 20 or 50-fold what we're seeing for Black maternal health and those sorts of things. I think caregiving, like you mentioned, that you're studying is something that does not get a lot of, I guess, doesn't get a lot of attention. And I mean, I think that goes part and parcel with, sometimes, social media is not going to highlight. Social media is really a language of the young, and so it's not necessarily going to highlight, the aging population and the needs of the aging population. But we're seeing more and more, that sandwich generation get really impacted by caregiving and thinking about, well, how do I provide care for my aging parent? And then this is going to impact all sorts of things, right? The prices of intergenerational housing, the services that are inclusive at that level, the COVID-19 pandemic, right? And so it's a real complex issue that we're dealing with. But I do think, like, if we went back to some of the sort of senior services or community services that need to be built in to take care of those things, they need to get a lot more attention, along with Black maternal care and Black mental health. Not to say that it's not important.
And I think they're very much connected, right?
They
because
are.
Like it's in Black maternal health. When I was dealing with my own Black maternal health, I was still caregiving.
There you go.
I was still struggling with my own mental health.
Yeah.
I was, like all of these things they're not kind of dissociated, right? Like if we try to think of it as as holistically as possible.
Yes.
And if we are, then that means that we have to, like you said, look at when somebody's in a bed, ideally look at their whole social cultural context.
Yeah.
If there were a couple of things that you would like, especially as an educator, that you would like health professionals to know about Black communities, and then vice versa, like what you would want Black community members to know about the healthcare system or professionals, what would be some key themes for you?
So in terms of the Black, I guess, health professionals knowing about the Black community, so in addition to, of course, that sort of broad definition of health that needs to be explored when we're looking at Black community members, I would say let's talk about trust. Let's talk about histories. Let's talk about the reasons why we're seeing the behaviors that you're seeing and thinking, why am I seeing this behavior? Well, it's rooted sometimes, and a lot of times, in colonialism, patriarchy, and in all of the systems that will say, you know what, I am not really trusting what this healthcare professional is telling me, because I've seen it borne out through history that there have been other times that we shouldn't have trusted them, kind of thing.
And you know what's interesting about that point is that they might not even know that that's why they feel that way.
Yes.
Like that's what because I know it's like it's a learned, it's a culturally learned thing. Like I know the feeling of being like 12 and not knowing at all what this means, but still being like, I don't want to go to the doctor.
Yeah.
Like, and why is that?
Yes.
Like how many times have you heard that in your household?
Yeah.
How much, and so this idea that we would all be eloquent and able to like explain that it's because of this racial trauma and all of this stuff.
Definitely not.
Is
Definitely
not
not.
the case.
Definitely not. And so we're talking about the sort of variability within our Black communities, and knowing that we're essentially not a monolith, that you're going to see a lot of things, and that there needs to be a balance in terms of being curious, but without microaggressing. So and those discussions are important. So like, how do I learn to be with Black patients or Black community members that are seeking healthcare? Is to stay open and stay aware of and listen to what's happening, and develop an understanding of what you're seeing. Based on some of the work that you're willing to do in order to meet the needs of the population, right? Because we kind of have to be willing to do the work, to get there.
And then vice versa. What
Right.
do you want the community to know?
So I would say the communities, because I think of elders in our community, and then I think of social media savvy people, and they're different sort of ends of the spectrum, and they're at a different level of knowledge about the healthcare system, and they access it in different ways. But I would say from a lot of the conversations that I have actually with people who seek me out in terms of making sense of the healthcare system, that we have to understand that the healthcare system as we see it is made up of individuals and humans. And so the ability to make error is very present.
Oh my God.
And I say that not to say that, I don't want you to think that, oh my gosh, I'm gonna walk into this hospital and there's gonna be an error, but just to know that it could happen, because we do have people who access the healthcare system and really feel like, quite naively, that it can't happen and everything. They must know what they're doing, and I'm here to tell you that they do, but things can happen. And so what kind of acts as a buffer to that is having people to accompany you through the system. And so one thing that I strongly advocate for with people that speak to me about going to the doctor or going to see a healthcare provider is having someone with you, having someone that you can speak to about your appointment prior to your appointment, to be prepared for your appointment, to have them see that, you know, you've got people looking out for you. I wish it didn't matter, but it does.
Yeah.
And so to have someone to have your back. So, you know, and I really do advocate for that in all spaces. Yes, wonderful if it's representative and someone close to you and you can access that. But certainly if there are services and where we can have kind of accompagnateur with people to sort of navigate the system, fantastic. Because I think that, you know, everyone has trouble. I have trouble accessing the healthcare system, and I worked in it for a number of years. You know, sometimes I'm like, did they call me for what appointment did they call me for, and how many numbers do I need to call? And now it's a lot more onus is on the patient to access it, remember it, do things. So I always wonder.
Has turned to being online, which I think,
Yes.
you know, so as a caregiver for my mom,
Yep.
I'm like I don't think she'd be able to navigate
Yeah.
the healthcare system at all. In the way
Exactly.
that it's become so electronic. And,
Yeah.
and you know what's interesting about that is because I hear you saying it in terms of Black community, but I really do think that it's it's something that impacts so many people, right? Like
Yes.
the amount of times I've gone to health appointments with friends, and they were blank. They forgot everything the doctor said. They
Yeah.
didn't ask the questions that they
I was there.
thought.
I was
You know
there.
what I mean?
I will never forget it. I was there too.
The whole thing, and
Yeah.
it's like, and being removed from the context a little bit because the diagnosis is not yours or whatever, really allows you to kind of come in with fresher ears, fresher eyes, more calmness, and like all of these things. I appreciate that, and I think that advocacy, because that's what I'm hearing from what you're saying. Advocacy is so important in terms of like community support, but also in terms of like self-advocacy. Like, you know, when they give you a diagnosis, like we're Generation Google, like take advantage.
Yeah.
You know, like all
Absolutely.
of that is so key. And one of the things that I think has actually been really beautiful about the change, like I guess like the transformation of healthcare, and where you can go to your doctor and be like, well, hey, I looked this up.
Yeah.
Which was not a possibility, say, like
Right.
10, 15 years ago, right?
Yes, exactly. And so you don't have to take exactly what they're telling you as sort of, you know, the Bible truth. You need to sort of be okay about questioning and having that. And that's what informed consent is, right? Like, it's, you know, getting a second opinion and then how do you do that? Right?
Yeah.
Getting a second opinion if you're asking questions, and ask the questions. I say that because some people just don't ask questions.
Yeah.
Sometimes it's just not in your nature. You just kind of go along with it and accept it. And that might be okay the majority of time, to tell you the truth. But I will say you want to make sure, particularly if you are from, you know, communities where the history has been that your voice is not heard, or your voice is heard less than, then you want to make sure that your voice is heard and do everything that you can in order to make it more so.
No, I really appreciate that. And you know what I also hear from what you're saying is that there's, you know, there was a time, like, especially so my parents are Haitian, in the like Haitian context, where the word of the doctor is like the word of God. But it's also like, I think that also
Yeah.
impacts our like young health professionals
Yeah.
who might be choosing careers based on not wanting to have that kind of pressure too, right? And not wanting to be the holy grail, to know that a lot of this stuff is in conversation with one another. There isn't necessarily, like, yes, they're experts in their fields in the sense that they've practiced and studied, but not in the sense that they're not human,
Yes.
like what you're
Exactly.
saying, right? And so
Yeah.
how do we get to a point where we're seeing our healthcare professionals as part of the conversation rather
Yes.
than, this top-down only
Yeah.
kind of situation?
Yeah.
If you were to see, if you had your top 3 changes that you want to see in community health in general, especially in Black community health, they can be the top 3 in this very particular moment.
Oh my gosh, top 3. Wow. Okay.
What would you like to see?
Okay. Okay.
Hot seat moment.
I would changes. Okay. I probably have talked about a number of these changes before. I mean, first I want to say data. Right? I want to say data and research, right? I know we poo-poo it and we're like, oh my gosh, like, are we going to have another meeting, a consultation and whatever and this. If you knew how many causes get started, you need to have the data to get the money to do the thing, okay? So I want that point to be heard.
No, for sure, and people need to understand that. I think
Yes.
that there is, like, especially when people who are not in healthcare
Yes.
think that is like unnecessary, I think it's really key to really educate people on why it makes a difference. So
Yeah,
thank
when
for
you
bringing that up.
understand the way things work and the way that the argument needs to be constructed in support of data, it isn't just like, this is how I feel and this is my history and this is, which is borne out and totally true. But the data will need to support it. And I say that also to say that the lack of data as well has been a real hindrance to the focus on Black health in the past. I remember teaching in, probably 2000, like the early, maybe 2010, we had this change of government, and I remember Harper had decided to like not collect this like StatsCan data, like demographic data. And I remember thinking and speaking to my students, we were having this big conversation about like what would be the impact of not collecting that data. And so if you don't count it, if you don't count that it is true, then it isn't true and you don't have to treat it, right?
Yeah.
Right? It isn't a problem if you don't collect data on it. And so I think we've seen a reversal of some of that. But I think that is so important to our history, I think in the Black Canadian context.
Yeah.
Because for a very long time, there wasn't a lot of data to support some of the sort of, I'll say, risk that we were seeing in the Black community vis-a-vis healthcare. And other community groups were being counted and we weren't. So it's like, what? Black people, something's going on with Black people? Yes, in the US, that's happening.
Yeah.
And so that leads to that myth-building, right? Around, slavery happened here? Like,
Yeah.
and that importance of documentation. And so now, though, there's been a lot of, activist groups and movements around count it, right?
Yeah.
Count it in COVID.
Yeah.
And so we've seen a lot of, movement around, like, if the data's staring you in the face, there is some way that you could ignore it, of course. But
if you're willful, you will find a way.
Yes, you will find a way to ignore it. But you can't ignore that something is happening at that level.
There's also so Dr. Jude Sena in Ottawa has been working on this a lot around what do we call Black when we're doing this data, right?
Yes.
Because it's like we know that there's multiple Black communities.
Yes.
But in the context of data, like
Yeah.
we need a definition for Black, particularly in healthcare, in order to be able to kind of push for some of these things. No, it's not all culturally specific, right? Like, yes, I think. Maybe if we like look south and we're like, okay, well, in the States, it's like they have this amalgamation of like everything's Black, it's a monolith or whatever, and then here we have our different, culture groups, country groups, whatever, and so on. But there's also like we know that there's certain things that do impact us because of skin tone. There's certain things
Yeah.
that like, and so how do we get to like a definition that's inclusive enough to get that type of data that we're looking
Absolutely.
for?
I think in terms of our numbers, we need to look at maybe a short-term and long-term plan around that, you know? So maybe it's going with a definition. I'm like so not an academic. I'm like, maybe we'll just go for it with a definition right now.
No, but true.
But academics will not do that. Academics will like, let's wordsmith this to death until we get a definition everyone agrees with.
But it's like, but we need both, like speeds, I think,
Yeah.
right? Because there is a certain, that's like, we can't just stop till we have
Yes.
the perfect definition,
Yes.
right? So,
And that's often what I hear as a criticism for this, like, oh, well, how long is it going to take you to create that data? And me too. Like, I'm impatient for, you know, when it's like, okay, we're going to have some more interviews with the students, right? It's like, no, we've got the data. Let's
Yeah.
move, you know? And so some things we got the data, let's move kind of thing.
yeah, for sure.
So I would say probably yes. Collect data. Let's do more research so that we can kind of support some of the practice, the initiatives that we want to see done. And then I would say, just because my heart is always in Black maternal health, is probably in Montreal and maybe in Canada. I'd probably like to see more Black doulas.
I'm working on it. I'm doing my training. Just so you know.
Oh my gosh, we have so many things to talk about. Look at that. So I'm always partial to, and of course, this is not to negate any of the things that are already being done, because I know that things are being done in terms of speaking out about it and then organizing. And I also know of, you know, the numbers we have in Montreal to support said practices. But I really do believe in again, representation and having someone like you support you through pregnancy and birth is really important. And doulas, of course.
I think everyone should have a doula training. So my grandma was a midwife in Haiti. And when I talked to my mom about birth work in general, she was like, it's so crazy to be in this place and know that most people know nothing about birth work. And that is so, like, it doesn't make sense to her because in her village, you know, yes, you had your assigned midwife, but like, technically anyone could help you give birth because everybody was knowledgeable enough about it that if there was some sort of emergency situation, they got it down. And so that's why not only like I want to do the doula training, yes, because I think it's interesting, yes, because I consider that I would do part of it, but also because I think it should be a baseline for our whole community.
Yes. And it's funny you say that because I'm just off the heels of seeing Woman King, yes. But I also am all about really recognizing, like, this is our space, right? Like, take the space, because historically we have actually a very large tradition in birth work, right? Like, this is part of reclaiming that past that was erased. And not nurtured, right? And then finding us without any knowledge in this generation of like, oh, what? Like, how do I do this? When it's like, no, you were supposed to have this training and traditional practices. And so when I say that, like, there isn't only lack in the Black communities, there's actually so much power and so many things in terms of recognizing our capabilities around birth work, around spirituality.
Herbal medicine,
exactly,
like
naturopathic, you know, and so that's one thing that I would like to see when saying so, an integration of, you know, what we say is westernized medicine, an integration of that with naturopathic medicine in a more sort of formal way. Right? And so we've been talking about that for many years, but very much, you know, particularly in the Black communities, it's really seen like as a side thing, and I'm just gonna, you know, oh, I'll see my naturopath, you know, when things fail with Western medicine kind of thing. And I'd like to see, like, how can we marry that? How can we integrate that a little more fully? Because again, that's part of our histories, and something that we should really, you know, grab a hold of.
Yeah, for sure. That's really good.
I don't know if I've given you 3, but I feel like I gave you like 5.
I think more birth workers. I'm hearing more data, more birth workers.
Right.
And I'm also hearing, you know, and like an integration of Western and, you know, like Afrocentric ways of being, right? And Caribbean, and I mean, there's so many different ways that we approached health over the generations. I love that. I think that that's such a important shift to see, and one, especially the last one, that I don't see as much, right? I definitely see more birth workers. I definitely see a push for more data, but I don't see as much of I think there's a splitting happening, right? Like there's there's like a few people who are like, I want to go to the naturopathic way and are really doing that, but then they negate Western medicine.
Absolutely.
And almost in a way of, I find could be problematic of dissuading our community to engage with Western medicine.
Agreed.
Entirely, which is really scary to me because these health institutions should belong to us as well, right? And so,
Agreed.
like, creating more fear for our community to go to doctors is like, that's
Probably not the way to go.
Like, I'm really not about it. Like,
Probably not
let's
the
bring
way to
it back.
go.
And like, we can have naturopathic ways without,
Mm-hmm.
you know, dissuading our community from that. And then on the other side of just like, oh, you know, you're gonna do a sericity tea. Well, what's this? But like, that's actually really important. You
Exactly.
know? It's been, and how do we get data about that kind of stuff?
Well, this
too?
is it. Where's the research about that?
Yeah. Wow, for
Absolutely.
sure.
And
I
what
love
you were
it.
saying related to not knowing that some of the fear, because you're just like essentially, you know, negating Western medicine, you're just essentially taking hold of that fear of Western, probably because of betrayal and mistrust from, you know, historical encounters or experiences. But do you even know that that's why, right? Do you even know that that's why you're behaving in those ways?
Yeah, for sure. Oh, that's amazing. What role do you see for non-Black community members and for people who are not necessarily healthcare professionals, right? So I think it's maybe easier for healthcare professionals to kind of get their, like, okay, my patient is from diverse communities, so I should be involved. Black community, obviously, because it's their own concern. What is it for non-Black, non-healthcare community members? How do they get involved in these conversations? What's the stake for them? How would you like to see them participate?
Wow. So I do believe that allyship is essential. So I believe it's essential because we can't build this on our own for various reasons. I think that Black communities' healthcare is a concern for our healthcare as a whole, right? And that's just not, I mean, I hate to use like fiscal responsibility around this. It's like, if I'm costing the system, like you got to pay attention, right? But you should care for more than the fact that it's like hitting you in your pocketbook. But that's one reason. And then two, I mean, it goes back to, for example, like why did I choose a diverse school for my child, right? Because I think it's important for him, but I think it's important for everyone else as well.
Yeah.
Right? And so the diversity, the representation, the whole person care, the fact that it's inclusive to, you know, all communities, that's a win for us all, right? That's a win even if you're not part of that particular group. And so I do think that if you're wanting to be involved and you're not part of that community, one way that allies can give, that allies can help is giving voice to and giving space, right? And so elevating, making space so that other voices are elevated. And I've seen a lot of the colleagues that I work with do this really, really well. And make space for me. I've had, you know, times when space has been given to say like, oh no, like let's see what Kimani thinks about this particular issue, kind of thing, because, you know, lived experience and such. And I think that that's really powerful. I think that they can give voice to in different arenas about what's happening, because yes, if I call this chair Black, you may or may not believe me because I'm here. But if someone from another community says like, oh, you know what, Kimani said this is Black and I really saw it too, and I like, that's another discussion. And that's where we're at as human beings, right? That that potentially, you know, someone from another community calling that chair Black is actually usually seen, you know, as more truthful or truth-bearing than me saying it. But I think all of it helps right now. I think that's where we're at, and we need to continue building together. Yeah.
I also, from what you're hearing, I'm hearing a lot of collective curiosity. Yeah. Right? Like this, it's so interesting because I think that when it comes to race, people are like, oh no, I should only like care about the, you know, the skin that I'm in, right? But when it comes to everything else, like it's not like you're like, oh, I'm not a baker, so I don't think about bread.
Exactly.
I just don't.
Exactly.
Like, it doesn't cross my
Yes.
mind. I never think about these things. Like, how do we get to a point where there's no taboo about what I'm allowed to think about, what I don't care about, and so on and so forth?
And you wouldn't, just going along with that analogy, it's like you wouldn't think twice. You'd be like, oh, okay, it's about bread. Why don't we ask a baker?
Just
right?
ask a baker.
Just ask a baker. Just ask a
Baker's
black
out.
person about their health.
It's so simple.
Not
The
rocket
baker
science,
knows,
right? Not
you
rocket
know?
science. Yeah,
No, for
absolutely.
sure.
I think like we need to, it's like we need some voices at the table, but at the same time, we need to like burn the table and build again, right?
100%.
So I do feel like there's stages to this. We're at another stage of like right now, what's opportune about this moment is that there's been, you know, I guess development in terms of the numbers of faces that you see. There's been a bit of a shift. And so now it's a real critical moment about sustainability, but also, you know, what are we going to do and how are some of those like power dynamics as well going to shift things? So there's still a lot of work to be done in a lot of spaces. Like the war isn't won yet, kind of thing.
For sure.
Yeah, we still trucking on.
Amazing. Well, thank you so much. I want people to know how to get in touch with you, to know what else you're doing. So what's the best way to kind of either keep in touch? Are you on social media? How do you do some
Let
of
me
that
see.
stuff?
Am I on social media? Not really. Not in this space. You know what? I do have a Twitter handle, I guess, but not super active. You can actually check in my LinkedIn account is probably a great place to get in touch with me.
Awesome.
You can also email me at kimani.daniel@mcgill.ca. And I will get your email if you're wanting more information or opportunities or just wanting to chat about Black health.
I mean, I want
I'm
people
here
to,
too.
you know, want to continue this conversation with you.
Yeah.
So I'm really excited. So definitely check out Kimani on her LinkedIn or via email. You said
Yeah.
kimani.daniel@mcgill.ca.
McGill.ca. Yeah.
So that's that. Any final thoughts that you want to leave
I
everyone
am
on?
so happy. This talk could probably go on forever.
Literally
This space
could.
is amazing, and I do want people to know like the space is really amazing. And so I'm looking forward to like future chats. I'm already planning
Oh my
about
gosh,
using this space
100%,
already.
100%.
But thank you so much for having me. It was wonderful.
Thank you so much. It's on to you, Anna.
Woohoo! I'm just excited. Well, thank you both. We do hope to have you back in the space, Kimani. So welcome back anytime. But we do appreciate your time and this conversation. And yeah, we kind of do wish it went on a little bit longer because you had so many important things to say. Thankfully, we did live stream it to YouTube so we can share it with folks who signed up and couldn't make it today. But hopefully they'll take the time to have a listen to your words. Thanks so much for sharing with all of us. All right, folks, we're going to close up the Zoom and end the live stream, and we'll welcome you back to further conversations that Annick will be hosting on Friday. Is that October 1st this Friday? No.
No, the
it's-
30th.
Sorry, the 30th, September 30th. So please check out our schedule on concordia.ca/4 for all the details on how to join those chats. Bye, everybody. Have